Health Officer to add to my comments, and then we're happy to take any and all questions you have.
Thank you, Premier. This certainly is Thank You Day. I want to thank every single Victorian who's been through so much these last 18 plus months. Again, to the healthcare workers, from primary care, community care and hospital care, who've worked so hard, who continue to work so hard to protect us all and to care for us all. And then to everyone who's really reached out to others through these really difficult months. I know that people have needed extra support, and there have been so many people who've volunteered their time and who've really had a focus on others. And really, the thing that struck me through the last year and a half, maybe more than anything, and maybe in Victoria more than anywhere else, is the way that we've thought about all Victorians in the things that we've done. Of course, there's benefit for us in getting vaccinated, but there are so many conversations I've had where the focus has been on what we need to do for everyone in Victoria, what we need to do to care for everyone around us. People have done the right thing in following restrictions with that in mind and with the care and compassion for everyone in this state in mind, and that's been a really wonderful thing to watch. It has been a long time, and the lockdowns have been so difficult for so many. I think we understand why it was required. We had 20% full vaccination coverage when we went into this lockdown for the eligible population. We could not have carried on without restrictions in place, without many, many hundreds of people dying. And again, we thought about that risk and we thought about what it would mean not to follow those restrictions, and we've done a fantastic job to get to this point in time. So please, let's celebrate it. Let's enjoy this lovely day and many lovely days to come with acknowledgement that we do deserve it, that we should enjoy it, but also that there'll be people who do feel anxious, might be timid after such a long period of time. Don't feel obliged to respond to every invitation to be out and about. Do what you feel comfortable with. Recognise that it's not easy to have had such a long period of time in lockdown to then kind of emerge into the world, but enjoy the things that you do deserve, and please start to book in those things for yourself, including seeing family and friends that have been a long time coming. There is a long way to go. We need to punch through those thresholds, the 80% fully vaxxed threshold. We absolutely can and should punch through that 90% fully vaxxed threshold. We know that there are still challenges in countries that have very high vaccination rates, and we want those challenges to be as minimal as possible, and the way to do that is to have as fully vaxxed population as possible. We've got some terrific signs. The fact that there have been more than 90% now who've got their first dose amongst eligible populations from 12 years and above means that there's every expectation that we'll have more than 90% fully vaxxed for 12 and above. That'll mean 80% or thereabouts across the total population. That should mean that we lock in some of these freedoms, some of these wonderful choices that we can have going forwards. And it's the best insurance for us and for our healthcare system. But as we start to reopen, there will be more COVID in the community really than at any other point in time. Many of those people will have mild illness because they're fully vaccinated. Many of those settings will have fully vaccinated people, but recognising that children will also be in those places and some exempt individuals will be in those places, and that getting vaccinated doesn't mean that you're absolutely guaranteed not to get the virus. You can get mild illness and you can pass it on. So we have to bear in mind those other really important protections. Checking in, wearing a mask will be really important, and on days like today, opening every door and window in sight to let that fresh air through, that'll be a really important measure. Usually at this point I'd go through the geography of cases, but that'll be in the afternoon update and available on our website. It hasn't changed largely, other than to say that the southeast of Melbourne has really seen the biggest load and the biggest surge in cases most recently. But as we move towards that 80% fully vaxxed threshold, I do want our public messaging to squarely focus on the fact that we're going to look out for our priority and at-risk populations. We don't want to leave anyone behind. We will reach into you, but please reach back out to us by taking those opportunities to get vaccinated. We don't want any priority population left behind, and we do want to punch through that next milestone and go beyond. And we will continue to communicate all of those change settings and approaches as we go forward. In terms of geography, though, I want to call out a couple of things. La Trobe is experiencing high case numbers, 70 new cases today, so big challenges there. But we've had days like that in the past in regional Victoria, and they pushed through with higher and higher vaccination rates and gotten on top of those numbers with the things that we know are the public health pillars: isolation, quarantine, and the contact tracing work that's being done fantastically in our local public health unit there. There is additional support for La Trobe. There's a pop-up testing team at the Traralgon Basketball Stadium. Did another 203 tests yesterday on top of all of those at the static sites. And as first dose vaccination rates in the La Trobe Valley have closed in on the state average of 91% of people 16 and above, the second dose rate is also catching up. It's at 66%. In Wodonga, we're also keeping a close eye. There is a significant outbreak in Albury, 50 cases a day in recent days. A little bit lower in Wodonga with 11 new cases, but really it's one city and there is a risk there. So we'll also keep a focus on that. We want anyone with symptoms in the Albury-Wodonga area to come forward for testing. And then on vaccination, always a good news story. For a week now, we've been administering more vaccine doses than any other jurisdiction. So we're absolutely punching through that 70% threshold and onto 80% milestone. We are determined not to leave anyone behind in that regard.
So we'll leave that there. We're still on some